Irritable bowel syndrome is a dysfunction of the bowel, and if you imagine that if you take a picture of somebody who has a bad leg and they're standing still, they look normal. If you video them walking along, you can see them limping. Well, the nearest analogy I can come to is as though your bowel limps. Everything about it will look normal. Every test will be normal. Every blood test will be normal. Scans will be normal. But the bowel doesn't move right. It limps. And that seems to be what causes symptoms of irritable bowel.
And would it happen any time you ate anything?
It varies from person to person. It's a syndrome, not a disease, which means that it's a set of symptoms that are peculiar to an individual, and one person's irritable bowel syndrome is not the same as another person. So the symptoms that people get may be diarrhea, constipation, both. Some people alternate between diarrhea and constipation. Bloating, feeling the tummy's full of gas, and sometimes the bloating is visible. Pain that comes and goes, pain that's colicky. Sometimes pain that's relieved by opening bowels. Sometimes the feeling that the bowels haven't been completely emptied when you open the bowels. All those things are symptoms of irritable bowel syndrome. Some irritable bowel syndrome is clearly triggered by food in some people, and some is triggered by stress, and some is triggered by we don't know what.
And so how do you treat it?
Because it's a syndrome, again, the treatment varies from person to person, and there are various ways of approaching it. Adding fibre to the diet can help some people, and we can do that artificially with prescription agents. Antispasmodics, drugs that act on the nervous system of the bowel to alter the way the bowel moves, can help for some people. In head-to-head studies between all the various agents that are used, the drug that actually comes out on top is peppermint oil.
Oh, why is that?
Peppermint oil is a natural antispasmodic, and it's no error, if you like, that we've learnt that the thing to eat after a heavy meal is peppermints. That's why we get our chocolate peppermints with our bill in the restaurants. It's actually sound physiological reasoning.
And so you could just have a peppermint tea, or you could drop some peppermint oil in some water or something like that?
Peppermint tea works, and a lot of people settle their bowel symptoms down with peppermint tea. Doctors prescribe peppermint oil in a capsule in a much, much higher dose than you could get from a peppermint tea, and those can be given on prescription, and they do work for some people. But as I said, it's a syndrome. It doesn't work for everybody. Brilliant.
What other bowel things? Piles. Do piles come under bowels? They do, really, don't they?
Yeah, piles are horrible.
What are piles?
Piles are varicose veins in your back passage, and they can occur inside the back passage, or when they get quite big, they can poke out into the back passage, which causes the little lumps that people feel. And when they're really bad, those varicose veins can lock off, and we call it thrombosed, and then they can really be quite big and very, very painful indeed. They occur when you're constipated. They can occur if you've had a gastroenteritis and a lot of diarrhea. That can sometimes bring them on. They occur in pregnancy. One of the banes of many pregnant women's life is piles. The treatment of piles would include things that make your stools nice and soft, so that you can pass them without too much discomfort. And there are a variety of ointments that you can put on piles to relieve the discomfort, all of which can be bought over the counter. And so therefore it would mean sort of getting inside there and rubbing the ointment on the location where the pile was. It sounds just grim, but people have to do it. Yeah, yes. If they are bad, the pile ointments come with little plastic applicators on top of them, which enable you to get to the spot. You can also get suppositories, which you can stick inside your back passage, and they relieve the symptoms as well. The problem in this country is we are very squeamish about our bowels. If we were French, we'd have no problem with this, because the French would actually rather put something up their bum than down their throat. And don't the Germans have a special shaped loo so that they can inspect everything before it gets flushed out? That's right. There's cultural characteristics in how we deal with our bowels, and the English are very stiff upper lip, and we don't like to talk about them. Yet we should, and then we'd probably all feel a little bit more comfortable. We should, and then some of the diseases wouldn't be stigmatised, and it may be that people would come to their doctors sooner rather than later, and some of the more serious conditions would be picked up.